Chapter 3, Sterile Compounding Supplies. Learning objectives for Chapter 3. Identify a variety of supplies used for preparing sterile compounds. Describe various components of the most frequently used sterile compounding supplies. Understand the rationale for using particular supplies in specific compounding situations. Identify the critical sites of commonly used sterile compounding supplies. The critical site is the part of the supply item that includes any fluid pathway surface or fluid pathway opening that is at risk for contamination by touch or airflow interruption. Critical sites must only be touched by a sterile tool to avoid touch contamination. It is vital that you can identify and know not to touch any critical sites on our supply items. Anything that interrupts the airflow from the HEPA filter to the critical zone or critical sites causes shadowing. This is another form of potential contamination. These are important components of maintaining sterile aseptic technique. All critical sites must receive continuous air and uninterrupted flow of the air from the HEPA filter. Anything that interrupts that airflow causes shadowing. Critical sites include vial tops once they have been sanitized with a sterile IPA swab, ampule necks, again once they are sanitized with an IPA swab. Needle hubs, shafts, and tips are always critical sites and should never be wiped with an IPA swab. Syringe tips and plungers also should not be wiped with an IPA swab. Tubing and spike and injection ports. Injection ports will be sanitized with an IPA swab. It's important to know how to correctly open and place supplies into the DCA. All sterile compounding procedures must take place at least 6 inches inside the hood to avoid the outer 6-inch zone. The space at least 6 inches inside the hood is known as the DCA. Along the entire outer edge of the hood's work surface, measuring 6 inches into the hood, sterile air from the HEPA filter will mix with the turbulent room air. This was discussed in Chapter 2. This area is referred to as the outer 6-inch zone or the zone of turbulence. Take great care when opening the outer packages of all supply items. The outer outer packaging is called a dust cover, and keeping the supplies items within the clean air zone. So on this illustration, this highlighted area is your outer 6-inch zone. That area is used for placement of packaging before it is open. Once everything is open, you want to open it within the DCA, this clear area here, and place it in the DCA, and then dispose of your outer packaging. To prevent shadowing, as discussed in Chapter 2, you want to prevent placing anything behind items that are placed into the DCA. Keep all items in packages on the outer 6-inch zone closest to the edge of the hood. Even though we will wipe them down with sterile IPA, they are still considered to be contaminated. Once we open the outer packaging or the dust cover, at least 6 inches inside, holding it above the DCA, when you remove the IV bag, you will place the IV bag, which is sterile, onto the DCA and then throw away the outer plastic dust cover into a waste receptacle. Keep all items in packages. That's what I just said. All sterile compounding procedures must take place at least 6 inches inside the hood, thereby avoiding the outer 6-inch zone. Identifying equipment that you will use in sterile compounding is very important. We will look at these pieces of equipment. We will label several parts of different pieces of equipment and identify the critical zones. First, we will talk about needles. The needle is attached to a syringe and then is used to either draw fluid into the syringe, which is known as a straight draw, or push fluid out of the syringe into either an IV bag or a vial. Needles come in various sizes and lengths. Regular needles are most commonly used. They're used specifically to withdraw or inject fluids for parenteral administration. Several components are common to every type of needle. The needle tip is at the very end of the needle, and it is razor sharp. The tip of the needle has a slant, which is called the bevel, and then the heel is a rounded part of the bevel at the point where the needle slant opening ends. This makes an inner core or shaft, which is known as a lumen opening, or the bore, B-O-R-E. The needle shaft provides the length of the needle and extends from the point where the colored hub attaches to the metal needle all the way to the needle tip. The inner core of the needle shaft is called the lumen. It's a hollow space through which liquid or fluid moves into or out of the syringe. The needle hub is at the end point to which attaches to the syringe. It has these little kind of wings on the end that will twist into a luer lock on a syringe. Needles come with a hard plastic cap that covers the needle shaft and tip until you're ready for use. That is the only part that you can touch with your gloved hands. All the rest of the needle, as illustrated here, are considered to be critical areas. We never want to touch the hub or the area that's going to attach to your needles or your syringe, because fluid will flow from the syringe through the hub, up through the shaft, and out through the tip. So the entire needle is considered to be a critical site. For measuring needles, there's two parts. The first part is the gauge. The gauge refers to the diameter of the opening or the diameter of the lumen, or as I said, the size of the bore. When liquid is drawn up, it will go through the opening. So when drawing up something that is viscous, which means that it's very thick or syrupy, the technician would choose a needle that has a larger gauge size, but would select a needle with a small lumen when providing an IM in medication for a neonate. The sizing is inversely proportional to the actual opening. The smaller the number, the bigger the opening. Most commonly, in preparation of compounded sterile preparations, we will use an 18 gauge needle. We are careful when we use a 16 gauge because it is most likely to cause coring of any kind of rubber diaphragm. Again, smaller needles are used when giving certain types of injections, such as an insulin injection. 27 gauge is common, an intramuscular to an infant or a neonate, a 25. But if you think about the equivalent of different kinds of straws, so a coffee stir straw has a very small opening, whereas a milkshake straw has a very large opening. So depending on what you're trying to drink, if you're just trying to drink a soda, most things will pass through a medium open straw. It's not a problem. But if you're trying to drink a milkshake, you don't want to use a coffee stir. The other part of measuring a needle is the needle length. We use needles according to length, and we pick them for the task that's being performed. For most compounded sterile preparation procedures, we use a regular needle that is either 1 inch or 1.5 inches in length. So these are our two common lengths. Using something that has a longer shaft could be potentially difficult and increase your risk of puncturing your IV bag when you're injecting your fluids into your final product. Handling needles. In practice, needles should not be recapped. However, in preparation of a sterile product, a needle may need to be changed, such as changing a filter needle and regular needle, or removing the needle to use a syringe cap to send an item to the nursing floor. When a technician needs to recap a needle, the swoop and scoop or scoop recapping method is safest. In this case, the IV technician uses the needle and syringe unit to scoop the needle cap onto the needle. This is done by placing the tip of the needle into the cap as it is lying on an IPA swab on the hood's work surface area. The reason we use this method is to prevent a needle stick. If you're holding your cap and trying to put the needle into the cap, you could potentially miss the cap and stick your finger with the needle. So until you have better practice with recapping needles, we will use the swoosh and scoop method. Other types of needles that are specialty needles include the filter needle. The filter needle is a needle, but it has a small built-in filter. It's also referred to as a depth filter. That's between the shaft and the hub. It's a little difficult to see in this picture, but if you notice where the pointer is located, there is a darkened gray area inside this hub of this green shaft. That is where the filter is located. Even though the shaft of the needle will measure 1.5 inches, if you were to put this next to a regular needle, the hub would be slightly longer. The filter in a filter needle is used to remove particulate matter from a solution. We use a filter needle in the process of preparing a compounded sterile preparation that is made from an ampule. When we break open an ampule, which is made of glass, there is a potential for glass shards, sometimes paint from the neck ring, to fall into the ampule and be drawn up into the syringe. So either when withdrawing the product or injecting it into the bag, you will use a order of a filter needle and a regular needle. We will discuss that more when we come to chapter 10. When removing the filter needle, there is some similarities: the whole needle itself, the hub, the shaft, the tip, the bevel, the heel, similar to a regular needle, but in the packaging they're different. Generally, a regular needle is inside of a paper and plastic wrapper, which peels open, and you peel it to expose the hub so that you can hold on to it with the paper wrapping still intact and attach it to your syringe. On a filter needle, it is contained in a plastic outer packaging that has a split here where the pointer is locating. You twist it and the bottom part comes off to expose the end of the hub. This will be your sheath that will protect your shaft. You can then hold on to this part and attach the open hub to your syringe unit. Other specialty needles include the vented needle. Vented needles are primarily used to dilute large volume or multiple containers of a parenteral medication in a powder form. These medications must be reconstituted prior to use. A specialty vented needle has a razor-sharp tip without an opening in the tip. The opening is actually within the shaft, and there's a sheath that slides up and down, so it would hold that closed, and as you put it into a vial, it would push against the diaphragm and push the sheath back, and then allow for the liquid to flow out. In actuality, we will not use a vented needle. You will, however, watch a video in Chapter 9 that will show you how a vented needle will work. Another type of needle is a transfer needle. This is used to transfer fluid from one vial or container to another. It is a double needle. So on one end there's a shorter needle and on a longer needle. This is packaged similar to a filter needle. So you would break the plastic and it's got little tabs that snap when you twist it, and you would take one end off, you'd insert it into your vial, then you would take the other one, generally you take it and put it into the powder first, then you would invert the whole unit with the vial attached to the needle and place it into the liquid, and then you would invert it again so the liquid would flow from one container into the other container. Next, we're going to talk about syringes. So before you began this course, you did an orientation that dealt with syringes. I know that you've covered syringes and pharmacy math, but we're going to review again. This is going to be about the specific components and identifying critical sites associated with a syringe, not about the gradients and useful of measurements. Sterile compounding technicians use syringes to withdraw or inject solutions as part of the preparation of almost all sterile products. What you see here is a series of syringes ranging in size from 1 milliliter, 3, 5, 10, 20, 30, and 60. Attached, you also see needles. Generally speaking, the brown is an 18 gauge, and these look to be 1.5 inch in length. Identifying the components, specifically the critical sites, the syringe tip where your needle hub will attach, we will be using all luer lock tips. So luer locks are threaded. And like I said before, there's little wings on the end of a hub of a needle, and that would twist into the luer lock. You want to twist it about a quarter to a half turn to make sure that it's tight on there, but not that it's so tight that if need be you can't remove it. But you can't have it on too loose or else liquid will escape out and you will not be able to properly manipulate your drug. Syringe tips can be either luer lock or what's referred to as a slip tip or a friction tip. Slip tips or friction tips don't have anything to lock onto, therefore we don't really use them very often anymore in compounding sterile preparations. You more often see a slip tip when you're doing oral syringe manipulation. The syringe itself is made up of other parts, including the barrel. The barrel is where we hold the syringe. That's how we control the syringe. That's where the calibration marks are located. That is the outer part. Inside the barrel, there is a black rubber-tipped piston plunger, which is the inside part of the extension of the plunger. The piston plunger and the plunger itself are considered to be critical sites. Most of your syringes will have a beveled area down towards the flat knob where your fingers can touch, but you don't want to put your fingers on the longer part of the plunger because as we push down, that plunger slides inside of the barrel. And inside of the barrel is called the inner shaft. So we've got to be careful because if the plunger is contaminated, it would bring those contaminants into the inner shaft. So all of those areas are considered to be critical sites. The flat end of the plunger, most distant from the needle end, is referred to as the flat knob, or the lip, or the heel. Another area that's not identified on this picture is this part right here at the end of the barrel. That is called the collar. we use the collar and the flat knob to kind of create a place where you can push against or pull towards to help manipulate extending or pushing down the plunger. So just a little bit of a review. The area that's highlighted in green are the areas that you can touch. The areas highlighted in red are the critical sites. The piston plunger is part of the plunger, therefore is a critical site, as well as the inside or the inner shaft of the barrel. Another component or piece of equipment or supply used in compounded sterile preparations are our base solutions. Base solutions are the fluid bags that are used to administer the medications to the patients. They can be administered without additives for fluid and electrolyte maintenance, or with medications that have been injected into the base solution. The most common base solutions include normal saline, 0.9% normal sodium chloride, sometimes also written as NSS for normal saline solution, D5W, which is dextrose 5% in water, D5NS, which is dextrose 5% in normal saline, D5.45NS is D5 half normal saline, which is 0.45%, or LR, which is lactated ringers. Lactated ringers is a buffered solution that contains electrolytes, including potassium. Identifying the components of the IV bag. Each IV bag will always contain a small plastic hang loop. That will be at the top of the bag. The IV injects additives through the injection ports. Injection ports, once cleaned with IPA swabs, are considered to be critical sites. Sometimes they are a tail portion. The one on the left, the tail is actually folded up a little bit, but when you straighten it, it hangs out to the bottom. Or it could be what we refer to as a belly button, or a button injection port, as located with the bag on the right side. Also are the tubing ports. Tubing ports is where the IV tubing is attached. The nurse will remove the rubber cap covering the bag's tubing port and insert the universal spike adapter onto the tubing port, or into the tubing port. Now, in a pharmacy, the only time that we attach tubing is when we are preparing a chemotherapy drug or a hazardous drug. Now let's have some questions. Most sterile compounding procedures use a regular needle that is this length. (1.5 inches). Sterile compounding technicians use these to withdraw or inject solutions. Syringes. Now for more questions. The large volume parenteral solutions. The LVP is commonly the prime source of hydration for the patient and is run continuously while the patient is unable to take oral liquids. Most LVP solutions are made with varying concentrations of sodium and/or dextrose filled with sterile water. During the sterile compounding process, personnel are preparing IV solutions that require medication additives. A large volume of sterile fluid that is delivered via sterile IV tubing is also known as an LVP base solution, primary IV, IV, or IV bag. Again, it contains that small plastic hang loop, and the IV technician will inject additives through the injection port. The size of a large volume parenteral is generally 250 to 1,000 milliliters, as was discussed in Chapter 2. Small volume solutions are known as IVPB solutions or piggybacks. An IV piggyback solution is a small volume of fluid mixed with an IV medication and administered via sterile IV tubing. Piggybacks are the type of small volume parenteral or SVP product that are usually piggybacked through a primary IV line that contains the IV-based solution. At the photo on the right, there's a picture of a piggyback that's riding on the maintenance or large volume parenteral. The components of a piggyback are similar to those of the base solution bag. You've got the hang loop, you've got your injection port, and you've got your tubing port. Also on an IV bag, you're going to see the product, what's contained in the bag. You're going to generally have a lot number. You're going to have its expiration date, and there's also often a calibration marking on the side. You're going to have the volume that's contained in the bag, and you're going to have who the manufacturer is. The critical site on an IV bag is the injection port once it's cleaned with a sterile IPA swab, and the tubing port once this cap has been removed. Inside of these ports is a hard plastic diaphragm. On the injection port, you have an outer rubber diaphragm through which you will insert your needle, and then when you're putting it through the bag, you're going to feel a little bit resistance as the needle passes through that more hard plastic diaphragm into the shaft of the injection port. When you remove the needle, the rubber diaphragm on the injection port end self-heals so it won't leak out. If you were to puncture the hard diaphragm on the tubing port, but then were to remove either the spike or a needle, it would have an opening that would just drip through. The IV piggyback medication is administered to the patient on an intermittent basis based on the frequency ordered by a prescriber. Many intravenous admixture antibiotics are delivered via an IV piggyback. There's also pre-mixed parenteral products. Some medications for administration by IV or piggyback are supplied in the form of a pre-mixed shelf-stable product. They would either be stable at room temperature or they're shipped frozen and packed in dry ice. These bags do not have an injection port, only a tubing port. You should never add anything into a pre-made bag. You would note, however, that sometimes it looks like they have a second tail. That tail is for the pumping process during the manufacturing of the bag. Here is a picture going back. This is a picture of a pre-made shelf-stable drug. So this has the outer packaging or dust cover, and this is the IV bag that would be contained inside. It's just kept on the shelf in the pharmacy, and we attach a label to the outside of the bag. We usually will flag it, so when the nurse opens it, she can peel it off the outer bag and place it on the bag that's being hung for the patient. This is a picture of a frozen piggyback. You see it's only got one port, the tubing port. There's no injection. It's only got one tail. These come frozen and are kept in a deep frost freezer that is at -20 degrees Fahrenheit. These must be defrosted and kept refrigerated until use. Generally, in the pharmacy, there will be a defrost area or a defrost table. It kind of looks like the perforated rack where they put the French fries at McDonald's. You know, it's that metal kind of shaped thing that has holes in it, so the air can circulate around the frozen piggyback. And then once it's defrosted, while it's still cold, they're usually dated with a date gun and put into the refrigerator. Their expiration date will be dependent upon the medication, and it varies if they're kept frozen, of course, they're going to be stable longer. Once they're under refrigeration, their expiration date will be shorter. So you will need to check the manufacturer's information to know how long that product is good under refrigeration. We sometimes refer to these as popsicles at my hospital. Other types of premixed parenteral products. We have items that are called Advantage, Mini Bag Plus, or Add a Vial preparations. These products require sterile compounding personnel to screw or snap a specially built vial onto the IV piggyback designed for this type of attachment, and this is performed in the hood. So here we have a picture of an Advantage. So this cap is removed, and then the special vial, this cap is removed, and it actually screws into the top of the bag. And then the nurse can activate it prior to administration, and that's where the tubing port is located. This is a Mini Bag Plus. It's got a cap. Inside the cap there is a spike, so it's got a foil cover. We remove the foil cover, expose the spike inside, and it's placed over the top of a vial, and it's snapped down onto the vial. When the nurse is ready to use it, she snaps the neck here in this insertion port, which allows the fluid to go into the bag. She squeezes the bag, the liquid goes into the vial. She turns it upside down, squeezes the bag, and the pressure draws the diluted drug back into the IV bag, and then she attaches the tubing and is ready to hang the IV bag. One advantage of this type of IV piggyback is that it can be mixed just moments before the dose is required. This is helpful if the medication is not stable for long periods once it's in its mixed form. It also helps control waste and cost because if it's not used, it can be relabeled, which means reused, because the systems are usually stable for upwards of 30 days. Pre-mixed parenteral product IV bags contain standard dose of potassium chloride. As you see here, this is a potassium chloride large volume parenteral. Some could be famotidine, which is Pepsid, and then we also have pre-filled syringes that can be used for an IV push. Vials are another piece of supply that we use on a regular basis. Vials are sealed. They're sterile containers. They have a rubber top, and they usually have a metal cap over it, and then they'll have a plastic cap protecting the diaphragm opening. Most often, they'll contain sterile medication, either in a liquid or a powder form, or it may be a liquid diluent. Vials are considered to be closed systems. You can't turn them upside down and have the fluid fall out. There are two main types of vials. We have single-dose vials. These do not contain preservatives. These are known as SDVs. And we have multi-dose vials, or MDVs, that do contain a preservative. The shelf stability of a multi-dose vial, it's important to read the manufacturer's information to identify how long that vial is good. Now, for general purposes in a pharmacy, a single-dose vial can still be used for multiple doses, just for a short period of time. We generally will make sure that they are tossed out within a specific amount of time of first insertion through the diaphragm. Another type of vial is a mixo-vial. These are used infrequently by IV technicians due to the limited number of immediate use medications supplied in this type of a container. It is a little bit specialized, so here's a picture of one that has not been activated. At the very top there is a disc that covers the injection circle of the diaphragm. We break that disc off, which allows movement of this plastic cap. We push down on that plastic cap, which pushes down on the diaphragm, and that pressure pushes the rubber divider or stopper and allows the liquid contained in the top of the Mixo vial to go into the bottom where the powder is located. So there's the picture of the little tab on top, the plastic cap, the diluent is contained in the top portion, the rubber divider, and in the bottom is powder. Dislocating the plug releases the liquid into the powder, which is then dissolved and can be drawn up into the solution by the IV technician for either an IV push or a piggyback administration. Another vehicle that holds the medications that we use in a pharmacy to make admixture bags is an ampule. An ampule is a glass container. It is sterile and it's sealed and made entirely of glass and has a tapered neck. The ampule is an appropriate container for drugs that are not compatible with the rubber top or other components. Now, as you see here, ampules do have some slight variances in the look of the top, or what we call the head of the ampule. In Chapter 10, we will identify the parts of an ampule and how to properly break an ampule and withdraw the product. For now, we're just going to talk about what the ampules do. So a tech is going to break the glass at the tapered, scored neck and aseptically remove the liquid with a needle and syringe. So here on the neck you see there's a painted ring. So like I said before, when an ampule is open, you not only could have glass shards, but you could perhaps also have paint that get into the ampule itself, and that's why we need to use a filter needle. The other part is it says that it's scored. So when you actually get to touch the ampule, you'll see that it's got kind of a rough part. You're going to put your finger on it, that it's been scored with a file to weaken the neck of the ampule to make it easier to break. Once it's open, it is an open system. You see there's no diaphragm, so potentially the liquid could just come right out, which means that things could come into the ampule. It's very important that we maintain good technique because the risk of contamination of an ampule is even higher than the risk of contamination with a vial. Other equipment and supplies that we use in preparing compounded sterile preparations are IPA swabs. These are made with 70% isopropyl alcohol. Sterile IPA swabs are wiped across the critical sites of most of our equipment and supplies. Remember, we never swab a needle or any parts of a needle or the tip of a syringe. As you see here, they're wiping across the top of a vial. Generally, when you open your swab, you're going to hold on to one corner end and you're going to bring the swab across the site, the critical site, and you're going to wipe it 3 times. That has a couple different purposes. One is to physically remove any kind of particulates that have settled on top of the diaphragm, and 2, the IPA helps to sterilize the top. You'll then let it dry for a few seconds. Another piece of equipment that we may use is a vented dispensing pin. These are inserted into a vial or a glass bottle. Then you can attach a syringe. So by this part is where the spike is that would go into the vial, and then this end is where you can attach a syringe. So this is used to help make multiple things from a single vial without having to keep sticking a needle back into it and out of it. It's vented so that we don't have to worry about vacuums or positive pressure within the vial. An IVA seal is used after preparing your product. There are small foil stickers that compounded sterile personnel place over the injection port of the prepared IV, piggybacks, or other compounded products. This tells whoever's using the product that something has been added into this bag. They are also safety seals and can show tampering. So we've got a couple of different seals here. This is the common IVA seal that we will be using. They can go over the injection port. In this case, you see it over a button injection port, but they fold over and are used on a tail injection port. We commonly, just to remember what we're doing, we call it diaper the baby. This is an IVA seal for a syringe. It's got a rounded area that goes over the very tip of the syringe, and then you kind of pull down with your finger and your thumb to put it over the sides of the syringe, and then it would show when it's taken off. Some of it would remain behind, and it would show if it's been tampered. We never send a syringe to the unit floor with a needle attached. It will always have a syringe cap. Sharps containers are large buckets, usually red in color, made of thick plastic to use to safely dispose of needles, syringes, and broken glass. Anything that is glass will go into a sharps container. Plastic vials, syringes without needles can go into a regular garbage can. But anything that has the potential for being broken if it falls on the floor and could potentially cut someone or is contaminated should go into a sharps container. This is an example of a red biohazard sharps container. The ones we use generally have a wider opening in the IV room. There are two other types of sharps containers. One is the chemotherapy waste. It's a disposal for chemotherapy drugs. They are yellow in color. This is a smaller one. It would be kept inside of the chemotherapy hood. We may have a larger one similar to the red sharps container that our soft-sided or gowns and things could go into. And then the black is for other hazardous drugs. Another part of the equipment or supplies are sterile IV tubing. Although technicians rarely use tubing, the only time we really use tubing is when we're priming the tube for a chemotherapy product. It's important to understand and identify the parts of tubing. Sterile tubing is a supply item frequently used throughout the hospital. Primary IV tubing is sterile IV tubing with multiple injection ports, potentially. Nurses will use the IV primary tubing to administer a base solution to the patient. Secondary IV tubing is shorter. Sterile tubing may or may not have injection ports. The IV technician will use secondary tubing to transfer solutions from a source container to a bottle or a bag, or be used for priming the tube of a chemotherapy agent. To use tubing, you insert the universal spike adapter into the tubing port. There's a drip chamber. So once we insert it, before we insert it, it's very, very important to use the roll clamp, which is shown here, or you can use a slide clamp. It will pinch off the tube. The tube is like an open hose. So we have to close that off before we insert it into the bag. Once we insert it into the bag, then we would pinch the drip chamber and allow fluid in. And then we would open the roll ball and you can count the drips. So when you were doing drop rate calculations, this is the function of the drip chamber. At the far end of the tubing, there is a place where you can attach a needle, and that is called the needle adapter. It will have a cover on it because it is a critical site. So the critical sites on tubing are the port, the spike, and the needle adapter. It may or may not contain an injection port. An injection port is also considered to be a critical site, and nurses, if they're going to put something into that injection port, would need to sterilize it with an IPA swab. Equipment includes repeater pumps. Some facilities compound with a repeater pump. It helps to rapidly transfer sterile liquids from large volume or bulk containers into smaller volume containers, such as a syringe or a vial. So we see here we've got a large volume of an IV that's been made, and it can be programmed to pump the specific amount that's wanted, and over here we have the device where you attach whatever it is you're going to fill. Here we have a syringe or a specialty delivery device. When personnel must prepare large batch of fluid-filled syringes of the same volume, a repeater pump is an excellent alternative to drawing up the syringe from a bulk container by hand. Miscellaneous sterile compounding supplies are other supplies that are used less frequently, but still of importance to the work of an IV technician. It includes syringe caps, lure-to-lure connectors, membrane filters, and empty evac containers. Syringe caps are small plastic caps that attach to the tip of a filled syringe. So here on the left, now you did use syringe caps. They're a little different for the oral liquids that you drew up in Lab 106. These will have a lure lock on them. A couple different, there's a clear one, there's a green one, they come in different colors. Over here, this is a safety cap, and it actually has an inner plastic cap, and then once it's attached and it's tightened on, this red outer cap just kind of spins unless it's detached, and it leaves a red circle piece of plastic on behind the clear lid so people could see if it was tampered with. So if you're sending narcotics to the floor, you would need to use a tamper-proof syringe cap. Lure-to-lure connector is a plastic tube that has lure locks at either end. So it's got little wings on either end here, and it would attach to syringe. You could put a cap on it perhaps. Generally when we hold them, each end that attaches to the syringe is considered a critical site. So it comes with these sides that you can pinch and hold on to attach and detach from the syringe. Also, there's a lure to slip connector. This will not lock as a lure to lure does, but this may be used when you're using a repeater pump. A membrane filter is generally 0.2 microns or smaller and is used to sterilize solutions that have been prepared using non-sterile ingredients. So these membrane filters are generally used in preparing high-risk compounding products. There are times when some drugs do potentially have a precipitate, and for safety reasons not to have something go through like a crystal or a precipitate, an inline filter is indicated. An empty evacuated container is also known as an EEC. It is a sterile empty vial or a glass bottle that can range in size from 2 milliliters to 100 milliliters. And we use these for different things. A large evac container can be used to compound a TPN, where a small evac container could be used to make special dilutions for pediatric medications or other types of making batched products. Now it's time for more questions. The Sharps container is usually this color in the pharmacy IV room. Red. There's also specialty Sharps containers that could be yellow or black. There's actually also blue. Some sterile compounding facilities use these to rapidly transfer sterile fluids. That would be a repeater pump. Now time for more questions.